Okay, I think we're ready to get started. So Matt's handing a couple of handouts out. I don't know if we have enough for everybody, but also the handouts are on the web page. So I think you probably got that address. So if you just click on that, that'll give you the PowerPoints as well as this handout that's coming around. But I wanted you to have the handout just so that this way we could kind of refer to it as we're going through the presentation. So anyway, I'm Dr. Caviola. Most of you know me as the addictions guy. I got to tell you this story really quickly. Some of you probably have heard it, but my kids were in grammar school. Their first grade teacher, because my wife is also in the addictions treatment field as well. And so they were going around the classroom, and so they were asking, the kids, what do your parents do and everything. So they get to my son, and they go, Jay, what does your mom do? And his response was, my mom does drugs. So we were waiting for Dyfus to show up, that night. But he was great for things like that, So anyway, we're going to be talking though today about personality disorders, because that was one of my other areas of interest and research. And here's what happened is that through my private practice, I was getting a lot of referrals through different employee assistance sources. So employee assistance counselors at like Bell Labs, when we had Bell Labs, and United Airlines and a few other companies were referring clients. What was really interesting is that a lot of them were talking about difficult people that they were working with in the workplace. So from there, we began actually doing some research, collecting data, and what we did was we asked people, what were some of the traits or characteristics of the people that you find difficult to work with? And so people had a number of different, it was like an adjective checklist. And so as a result of that, we actually got 3 books out of it, and we're going to be raffling those off later, a couple of them. So I have to qualify, though, toxic coworkers does not pertain to any of my faculty colleagues, okay? Because they're wonderful. No, we're very fortunate. I mean, because sometimes you hear about academic departments, and as you can imagine, there are a lot of egos that float around in academia. So, but I'm very fortunate to be working with a lot of great colleagues, and we have a very collaborative approach towards things. What was really interesting, though, is after these books were published, especially the first one, we'd get these calls. So, I was interviewed by like Forbes and Fortune magazine and, some of these other things, other, media outlets. And what would happen is that, it started off where, like, if there was a workplace shooting, they'd call me and, or my colleague and then say, describe some of the precursors to things like this. But then what happened was they'd start to call us around the holidays and talk about, what if you have a difficult family member? So I don't know if any of you run into this situation. Thanksgiving is coming up in a couple of weeks, right? So I've compiled a list of topics that you may want to avoid. It used to be where you could always talk about the weather, but, that might, right? You might get into climate change, and, people are very, they have very definite opinions about this. This says don't talk about witch hunts or witches or anything like that. That's going to bring up a lot of things. Anybody familiar with Randy Rainbow, by the way? Oh, yeah, check out his YouTubes. He's very creative guy. So as counselors, we know that sometimes we have to redirect. So when some of these itchy topics come up, you might want to redirect the conversation. So here are some suggestions. How about those Jets, Giants, or Knicks? Because they all suck. I mean, they're horrible. As a matter of what was it, a week ago, the Jets and the Giants played each other, and we figured, well, somebody has to win, because at that point, the Jets were like 0-7. I think the Giants were 1-7 or 2-7, that sort of thing. And it's early in the basketball season, but the Knicks are already in last place, so pass the gravy, so. Now, this one might get a little dicey here. Because, every year, one of the roles of the president is to pardon, the turkey, right? The White House turkey. So, but don't ask, did he pardon any other turkeys? When is the next episode of The Bachelorette? Here's this one that's, did I mention I'm building a house on the Navesink River next to Bon Jovi? And Mexico's going to pay for it. Anyway, it used to, hope I'm not in trouble with anybody here. So it used to be, by the way, that we thought about personality disorders, that we thought about, they were a face in the crowd, that it just didn't seem that there were that many individuals that we came across that had some of the different personality disorders. But what we see today is, they are the crowd. Because I think we just see so many instances of this, and we're not going to talk about all the different types of personality disorders. As a matter of fact, I want to focus in primarily on narcissistic personality disorder and also borderline personality disorder, just in the sense that they tend to be probably the most difficult to treat. Also, I guess because we tend to see them in a lot of different settings, too. I mean, in terms of, they do tend to be a lot more pervasive. So as you probably know from the DSM-5, I'm sure most of you had taken psychopathology at some point or abnormal, but narcissistic personality and borderline personality are under cluster B, which is referred to as the dramatic or erratic type. So again, they're probably considered to be the most difficult to treat. So in counseling settings, they're difficult. They're probably the most pervasive in our society. The prognosis is not all that great, although one of the studies I'm going to show you, which is an extensive follow-up study that was done, might indicate something different than what we would expect. I wish I could tell you that medications would work, but they don't. As a matter of fact, one of the things that we were kind of finding out the hard way, was that in some instances, especially with borderline personality disorders, things like antidepressants would tend to disinhibit these individuals. And I remember it was actually about 4 or 5 years ago, and it was a Thanksgiving weekend, that there was a client of mine who had gone to a psychiatrist, was just put on an antidepressant, and had become very suicidal, actively suicidal. So that whole weekend, we're trying to get this person into a psychiatric unit for safety reasons and things. Here's the other thing, is that as counselors, if we miss the diagnosis, a lot of times we're going to get caught up in the client's drama. So we'll talk more about that in a bit in terms of what that looks like and how to avoid it. Oops. A lot of times personality disorders in general tend to get misdiagnosed, mostly because the clients come in with rather vague complaints. Things like I have low self-esteem, people don't understand me, I just can't do what I need to do, I guess I'm not getting enough out of life, I don't know why I don't follow doctor's orders, I just can't seem to get along with others, everyone at work hates me. things like that. Um, so the commonalities among some of the different personality disorders, a lot of times they're, they're certainly maladaptive, but they're exaggerations of traits. So think about avoidant personality. It's basically people who are shy. So that's the basic trait, but when it becomes exaggerated, then it kind of gets into this avoidant type of pattern. Think about, say, for example, with narcissistic personality disorder. Think about the distinction between somebody who's self-confident versus somebody who's narcissistic, right? So you can almost think of it like on a continuum. The other commonality is that the traits really result in impaired social and occupational functioning. We see that quite a bit, right? So that's always that catchphrase, causes significant clinical impairment and, social occupational functioning, that sort of thing. The clients usually lack insight into these traits. That's also a commonality. So sometimes we'd refer to this also as a failure to be able to reflect or to self-evaluate. So the person just is, they don't really see how they're coming across to others, how they might treat others, how certain remarks would be offensive, things like that. So there's also a tendency to blame others. So when problems come up, there's a tendency to kind of point the finger at others and kind of blame them for the difficulties rather than oneself. So there's kind of like this, almost like a denial type of thing. Usually the personality disorders are about deficiencies. They're about missing pieces. So it's not unusual that we'll see where the person can be very high functioning in some areas, but yet just really run into many, many difficulties in other areas. So I mean, these individuals, you could have somebody with narcissistic personality who can be very high functioning, and by the way, they find their ways into boardrooms. You have CEOs, right? You could have, university or college presidents. You can have even clergy. Run into many instances with clergy where you have somebody with narcissistic personality disorder, and they will wreak havoc on their congregation. And here's the thing that's, because I've run into these situations, usually I end up counseling the people who have been almost like victimized by some of these really difficult folks. And what will happen is, and I've seen this so many times, half the people in, say, the people who are victimized, whether it's in a company, whether it's in a congregation, whatever, half the people say, oh, this person is so wonderful. And then you have the other people saying, oh, this person is horrible. They're horrible to work with, that sort of thing. Part of the reason for that is because, especially with something like narcissistic personality, we also see it a bit with a borderline personality as well. These are very charismatic people. They're good at schmoozing people. They're good at the con, right? And so usually they tend to almost like kind of draw in about half of those that have contact with them. So it's not unusual to see that quite a bit. And the other thing is that, as you probably remember, that we don't diagnose personality disorders in children or teenagers because we know how screwed up teenagers are. As a matter of fact, my colleague of mine said, he was like complaining one day, and he says, oh my God, my teenager went through every diagnosis in the personality disorders. At one time they manifest certain things. And we know a good example of that is like with young teenagers, like 13-year-olds, 14-year-olds, that they tend to be very egocentric, right? They tend to be very self-centered. That's why they could be so cruel to their peers. When you hear about bullying and things like that, it's primarily because, they haven't really developed empathy yet. And not saying that with all 13 or 14-year-olds, but all I can say is God bless people who work in middle schools, because it's like, to me, that, right? And I worked in adolescent treatment. I was a clinical director of Monmouth Medical used to have a 49-bed adolescent treatment program, inpatient program, and we used to almost have to limit the number of young adolescents that we'd take in because they would just, turn the program on its head. They were so difficult to work with. So here are some of the things that we see, some of the also commonalities or consequences of having a personality disorder, especially the ones we're going to talk about. They have difficulty forming trusting relationships because they tend to misinterpret what people say a lot of times. They exhibit behaviors sometimes that are unreasonable or demanding. We see that especially with borderline personality disorder, and a lot of times with narcissists too. They exhibit behavior that is restive or avoidant, so we see that sometimes with the cluster Cs. They create upset and distress in the people around them. That's especially with the two types we'll be talking about with narcissistic personality and borderline. Sometimes they have a pattern of either shutting down or becoming highly escalated when experiencing strong emotions. And we'll talk about borderline personality disorder really as a disorder of emotional dysregulation. The presentation that seems difficult rather than clinically dysfunctional or impaired. So a lot of times if you have a client that you consider to be especially difficult, think about what are those difficulties. Sometimes we interpret those things as resistance. They show up late. They miss their appointments. They don't pay their co-pays or whatever it might be. But think about what kinds of difficulties are being presented. So other things just to watch for in general, chronic difficulties and dysfunctional patterns of behavior. These are folks that sometimes repeat the same problems over and over again. They are self-sabotaging, and you just sit there scratching your head going, oh my God, this person's doing the same thing over and over again and such. And they keep running into the same problems. A lot of times they've had multiple previous psychiatric diagnoses. And that's what I was saying, don't get sucked in terms of, their, kind of like, oh, the person presents as depressed, and so therefore it's primary depression. It might not be. So just kind of keep that in mind. A lot of times you'll see therapist hopping, or they might be what we call system abusers. They kind of cycle in and out, and they've seen many counselors, many therapists, and maybe they've been in many different programs and such. So again, repetitive relationship problems. Multiple marriages is not uncommon, or multiple relationships. And that's where sometimes they have to rule out bipolar in that regard, because we also see that pattern with bipolar. What was it? Zsa Zsa Gabor, the actress, had like 5 husbands or something. So, sometimes it could be, one or the other. Sometimes it's personality disorder, sometimes it might be evidence of bipolar. Shifting friendships and relationships, especially with narcissists and people with borderline, that they have a string of former friends. People that they've just kind of burned out people. They burn bridges, things like that. And they either tend to be in abusive or abusing relationships. Okay, so sometimes they might be the person who's being abused, but a lot of times we'll see that they might be in abusive relationships. Think about men who batter, right? Most are narcissists. And again, there's that lack of empathy, so they don't really see, how they're treating their spouse or partners and girlfriends, etc. So they tend to be very abusive. And as a matter of fact, what was happening is some of the early programs with male batterers, that were meant to treat male batterers, that focused in on developing empathy, it backfired. Because now they used the empathy, they knew almost what buttons to push, and it got worse. So it just, it kind of almost reinforced that it's your problem, not mine, type of thing. Oh, you ran into my fist, that type of thing. So it was actually, it backfired. So now most of the treatment in terms of batterers now is shifted towards getting them to take responsibility. And that seems to be more helpful. So here are the criteria. Grandiose sense of self-importance, fantasies of success, power, brilliance, or beauty, right? Believes he or she is unique or special. And by the way, that also kind of coincides with rules don't apply to me because I'm unique or special. They apply to other people, but rules don't apply to me because I'm above those, you know. And that's where, as a matter of fact, Milan, who's done a lot of work in personality disorders, kind of felt that maybe we should just combine this with antisocial personality, because you see a lot of sociopathic behavior with the narcissist, because again, rules don't apply to me, and I'm above everybody, I'm superior, right? Because ask any antisocial personality disorder who's gotten charged with like fraud or conning somebody, and what will they tell you? They'll tell you, well, I'm smarter than they are, right? So therefore, you know, it's their problem because they were stupid. You know, that's pretty much, you know, what you see with narcissism. They require excessive admiration, a sense of entitlement. They tend to be very exploitative. So if you're working for a boss or, you know, a CEO or somebody who has narcissistic personality, they think nothing of exploiting you. As a matter of fact, here's the classic one. They'll take your work, like if you come in and say, hey, I worked on this project, here's what I've come up with, they'll say, oh, that's great, and then they'll put their name on your work. So that's exploitation. Have any of you ever seen the movie Office Space? Right, Lumbergh, the guy who's the president of the company, is a classic narcissist. And there's this one scene where he's, you know, Ron Livingston, I think was the guy working for him. So he comes up to him on a Friday. Ron Livingston is trying to get out of there. You know, he's shutting down his computer. He's like looking around, and all of a sudden the boss shows up, right? This Lumbergh guy, and he says, you know, I need you to come in tomorrow, and probably on Sunday too. You know, there's some work I need you to do. And he's like, oh God, you know. So, but they think nothing of exploiting the people that work for them. Lack empathy is huge. It is huge. And let me give you an example of that. And again, I'm going to try to be bipartisan here, but this was just such an incredible example. Remember when President Trump met with the kids who had survived the shooting at what was Marjorie Stoneman Douglas High School? Remember, there was a group of the students and he met with them. So somebody had, I don't know, you know, one of the press or something picked up on, he had a piece of paper, and on the piece of paper it said things like, I hear you. You know, that must have been really difficult. These were statements of empathy that he was coached in terms of what to say. They tend to be envious of others, okay, that they have a lot of, in other words, there's an expression that it's not just enough that they do well, they want other people to do horribly. So it's, you know, it's part of that envy. You know, God forbid somebody else should get an accolade or something. Very arrogant, haughty behaviors and attitudes. So, and I think you have to have 5 of the 9 to reach the diagnosis, okay? So keep in mind that sometimes you get the full-blown narcissistic personality disorder if you have 5 of those 9, but other times maybe you'll get traits. You know, so the person is not necessarily diagnosable, or they don't have all of the above, but, you know, or 5 of the above, but they'll have some of the above. So in terms of NPD, narcissistic personality, it's more men than women, and the estimates range from about 50 to 75% men versus women, so it's probably about 75-25, basically. Again, the exclusive traits, self-aggrandizement, grandiosity, need for admiration, lack of empathy, rules don't apply to them. The important deficiency that these folks tend to have is equality with others. So in other words, rather than seeing others as equals, they see themselves as superior. Pattern of relating to others, it tends to be arrogant, demeaning towards others, or even just outright contempt. A quick example of that, I oftentimes refer to the wealthy eccentric. I don't know if you're familiar with people who they're just extremely wealthy, and basically they treat everybody like, like dirt, like underlings. Any of you are Downton Abbey fans? I mean, you kind of saw, this British aristocracy, and I mean, sometimes you'd have certain people that were empathic towards their staff, but then you had others who were just more like they're nothing. They're nothing to me. They're just there to serve my needs, that sort of thing. Their view of the world. Others exist to serve them, right? So, and their view of others naturally as inferior underlings. And they deal with the world through image management and a lot of times through rage. I don't know if you've heard the expression narcissistic rage. But when a narcissist gets confronted or the covers are pulled on them, that they really get very rageful. And as I was saying before, is if they come into treatment, it's a lot of times because they feel that they've been wronged. Others have wronged them. Take, for example, the example of the person who might be the clergy person or the person who's, maybe the CEO or something like that. If they are caught, in wrongdoing and such, that's when you may see this narcissistic rage, blaming others, they had it out for me, they were out to sabotage me. The Enron scandal was kind of an example of this, because I don't know if you remember the executives at Enron felt that it would be okay to pilfer their employees' retirement accounts, which was kind of a no-no, and they kind of they're caught with their hand in the cookie jar. So again, there's this blame. They're especially blaming one of the whistleblowers, Sharon Watkins, who actually spoke here at Monmouth a few years ago. It was very, very interesting in terms of what her experience was, because she was actually finding these accounting irregularities. She was reporting them to upper management, and he kept saying, "Oh, that's nice, oh, okay, thanks, keep up the good work." Meanwhile, they were manipulating the stock. They were doing all these kind of, nefarious things, but they were pretty much telling her, just be quiet and go away, So here's how others experience them as being selfish or self-centered, presumptuous, uncaring, demanding, or exploitative, as being manipulative, rageful, self-righteous, power-hungry, power-mad, insensitive, or arrogant. So if you or somebody you know is in a relationship with somebody like this, it's going to be tough sledding, right? Kind of tough going. I don't know if you could read this. Sally, will you make me the happiest man in the world and accept full responsibility if I should fail to be the happiest man in the world? So, okay, a little bit about etiology. Why are we seeing so many of these folks these days? It's not genetic. It tends to be nurture rather than nature. Oftentimes these folks grow up, we see this pattern all the time. You ever hear of stage mothers? And the male counterpart to that are coach fathers, because what they do is they kind of, play out their dreams and fantasies on their kids. You're going to be the star football player, you're going to be the star of the drama club or something like that. So, but they basically smother their kids, and it's like their kids don't have their own life. They're living their parents' life or the life they wanted to have as kids. Copter parenting, which you're probably familiar with, right? They are just all over their kids. So this goes beyond just, conscientious parenting. This is like they are smothering. And here's the classic example. So think about this. If you messed up back when you were in high school or grade school, and let's say the principal calls up or the teacher calls up your house and talks to one of your parents, think about what would happen. Because most often it would be where then you'd get in trouble again with your parents. But what happens today? Right. Yeah, parent wants to sue the school. They get really pissed off at the teachers. How dare they? You know, it's that type of thing. So that's what I mean by this kind of, copter parenting, that sort of thing. Here's the other thing. The child grows up knowing that they're really the center of their parents' universe. So everything is really going to revolve around that kid. And here is an example from a client that I saw years ago, where what happened is that his father was working, he was in a corporate setting, and so he's like a vice president or something. So that what happened is that the father was offered a job in another city with a huge promotion. And so he's all excited, he comes home, talks about this with his wife and says, wow, I just got this promotion. And the wife says, how dare you? We are not moving because it's going to disrupt little Johnny's life. So little Johnny grows up like, wow, I am the center of the universe. And so when he came into treatment, it was because of how he was treating other people that he worked with in his work setting. He was really, people were pretty much fed up with him. But he grew up thinking, I am the center of the universe, right? The other pattern we see a lot is overcompensation for inferiority. So people that grew up feeling inferior, there's this overcompensation. So it's like, I think, was it Anna Freud talked about, almost like reaction formation, where somebody takes on an opposite persona. There's an expression, as a matter of fact, this expression kind of comes from AA, Alcoholics Anonymous, because they find this quite a bit, where they say, we have so many people, they're egomaniacs with inferiority complexes. Because if you think about addiction, you knew I had to get around to this, right? That it tends to be a pretty egocentric lifestyle. So that's why you see that so much. And it's very interesting because even in the fourth step really has a lot to do with kind of looking within, changing character defects, stuff like that. So I don't know, narcissistic personality disorders? What do you think? What do they have in common? They're all white men, right? What else?
They're in the limelight.
They are definitely in the limelight. Andrea, yeah.
They're all sex,
Yeah, they all had accusations made about sexual improprieties of different types. By the way, do you know who this person is? Roger Ailes, yes. And Roger Ailes, a person who founded Fox News, and there is a great docudrama, I guess you could call it. It was just done on Showtime. It's called The Loudest Voice. And if you get a chance to see it, it's really an interesting study in personality. Because he was somebody, too, highly confident and competent. I mean, he built Fox News up from nothing to it has the widest viewership in the United States of any of the news outlets. So yeah, check that out. But also, if you want to also see a good video, Gretchen Carlson, who worked for Fox News, did a TED Talk, and just to get a view of what it was like working for Roger. Yeah. All in positions of power, right? Yeah, definitely. Think of Harvey Weinstein. Huge power, right? He dictated who was going to get which parts in Hollywood, right? Yeah, Matt Lauer, certainly, Bill Clinton, and long before Monica Lewinsky, was it Jennifer Flowers? You had Paula Jones, right? I mean, there were many of these instances of acting out sexual improprieties. Bill O'Reilly. Charlie Rose. So tends to be something that's very much in common. And again, I think also that what happens, some of these folks they say that Bill Clinton was an example, they said, where there was also kind of a sexual addiction. And there's also some bipolar things in his history too. His mom, they thought, may have been bipolar too. There's pretty good psychological type of biography done on him, which was really well written. But by the way, when we talk about presidents, anybody familiar with the Goldwater rule? You are, Dave? You've heard of that. So.
You're not supposed to diagnose from afar.
Right, you can't diagnose from afar. So somebody, right, who is not your client or your patient or somebody who you know directly, you can't, right, diagnose from afar. So that's why they're very careful in the book on Bill Clinton to kind of dance around that a little bit. So, now, by the way, I guess you also know the CEO of McDonald's was just let go, right? So, and also for sexual harassment of employees. So that was just in the past week. So it's, these things are just kind of ongoing. They just seem to happen with great frequency. And again, a lot of it has to do with power. As one of you mentioned, that these are people who are in positions of power. So I think where the narcissistic piece comes in is that, again, the rules don't apply to me. So, by the way, they didn't know who the person was that the CEO of McDonald's was harassing until they finally released a slide of this person. It's, just wanted to see if you're awake. Yes. Yeah, and when that happens, it's usually not a good, because it's dueling narcissists. Who's going to get the attention? Who's going to get the accolades? Usually they end up splitting up because neither person feels that they're meeting one another's needs. But here's the other weird part, is that many, many instances you'll get where a narcissist and person with borderline tendencies will kind of pair up together. And that's even, you can think even that's even like worse. So yeah, Tasha.
I always feel like the narcissistic personality helps them get to that position of power.
Right.
Is it like once they're there, it just kind of feeds it and then it's just cycle or?
Right. Yeah, that's definitely, I think, with what happens. As a person kind of attains more power, then I think there's this, it kind of could feed the ego in terms of saying then, I'm above everybody else, or, right. I think it kind of feeds off itself in a way. Yeah. So let's talk a little bit about borderline personality. So here are the DSM criteria. Frantic efforts to avoid abandonment, pattern of unstable and intense relationships. And boy, are they intense, right? I mean, so there's an unstable sense of self. As a matter of fact, the expression that's sometimes used is that people with borderline personality seem to lack skin. I mean, so that sense of boundary, that sense of with others and such, and they're lacking skin also means that they're very prone to, to everything around them. As a matter of fact, are any of you familiar with something called HSP, highly sensitive persons? Because that probably is one of those continuum things, because you have people who are highly sensitive persons, sometimes who are empaths. So if somebody is saying they're an empath, that they tend to be highly empathic, I think that could be one of those continuum things, because you have that at one end of the continuum. But if you exaggerate those traits, I think that's where you get into borderline personality disorder. They tend to be impulsive. And part of that could be either in terms of suicidal behavior or gestures, threats, or NSSI, which is non-suicidal self-injury, like cutting, self-mutilation, things along those lines. Affective instability, certainly. Chronic feelings of emptiness. And as you know, a lot of times these are folks who cannot tolerate boredom. Boredom is like just horrible and such. Difficulty regulating emotions, especially anger. So anger becomes overwhelming, as do other feelings. And then you have these transient paranoid feelings that kind of come and go. Part of that is, as I said before, because folks will tend to misinterpret what others say. It's kind of like you may say, oh, gee, gee, that was really nice or something. And it'll be like, well, what did you mean by that? That type of thing. I had one guy who was, and he was dating this woman, and they happened to be out for a date, and he gets a call on his cell phone, and it's somebody from work. And so, they'd ask him a question about something, that was needed for the next day. Hangs up the phone. So anyway, at the end of the night, he drops the girlfriend home. And about 3 o'clock in the morning, he hears pounding on his door. So he answers the door. What happened? Is everything okay? Who was that on the phone? Who was that? That's, accusing him of having an affair. That's somebody you're having an affair with, and just was really and he said this went on from like 3 a.m. till about 7:30 a.m. when he had to go to work. So it was just, really off the charts. By the way, a lot of times because of this fear of abandonment and such, you have individuals who do become stalkers, and they stalk people. So I had this one guy, a lot of borderline traits and tendencies, and so when his girlfriend broke up with him, this frantic efforts to avoid abandonment, he's like, he doesn't know what to do, and he thinks she's having an affair and all this other stuff. So she was living in a second floor apartment. He decides to climb up a tree outside of her apartment building and to look in to see if she's in there, and stuff. So I'd asked him, I said, wait a minute, let me see if I got this straight. So you're up in a tree, so there's an adult man in a tree. I said, what do you think if anybody walked by? What do you think they'd be thinking? What do you? Well, there's some big raccoons in the area or something. So. Okay, so let me give you a video example of this, if I can get this to work. But there's a trigger warning to this. So there is some violence, some nudity, profanity, adult situations, blood. I mentioned nudity, right? So those are your trigger warnings. So you may want to get coffee or something like that. So let's see if I can get this to work. And they said if I could, I'd be a stable genius. So, okay, let's see. Minimize this one?
Yeah, just minimize that.
Okay, and go to here. Oh, that's not the one I wanted, though. Huh. No, it's not. So minimize this one. Okay, shall I go back to here? Yes. Yeah. Right? Yeah. Okay, now play. Oh, great. Oh, you think? Oh, so close this. Oh, there it is. Okay. Yeah, great. Okay, so let me find the clip. Oh, no, not that one. Right, that was. Yeah, that was. By the way, if you want to get your spouse partner to not cheat, have them watch this a few times. Yeah, oh, I know. I'm hoping I can find that too. Shoot.
That's like the end.
Yeah, right. The bunny thing is at the end. Yeah. And how do we get audio?
What are you doing?
I gotta go.
So you said she wasn't coming back till tomorrow.
She's not, but I got things to do, honey. I gotta go home.
I don't think I like this.
Like what?
So he's having an affair with her, and he's kind of announcing that he has to go home to his wife.
Alex, what difference does it make whether I leave now or in the morning? The fact is, I gotta go.
Well, you're not going to leave now.
Oh, come on. Oh, come on.
I
Will
mean
you
it.
stop
I mean it.
Hey, come on. Hey, Alex, come on. What's the problem?
I'm sorry. reasonable. What? Thank you, goodbye, don't call me, I'll call you.
Look, you knew about me, all right? I didn't hide anything. I thought it was understood.
What was understood?
The opportunity was there, and we took it. Come on now, we are adults, aren't we?
What's that supposed to mean?
I thought we could have a good time.
No, you didn't. You thought you'd have a good time. You didn't stop for a second to think about me.
That's crazy. You knew the rules, Alex.
What rules?
Look, Alex, I like you. And if I wasn't with somebody else, then maybe I'd be with you. But I am.
Please don't justify yourself as pathetic. You tell me to fuck off, I'd have more respect for you.
All right, then fuck off.
Well, that's a mistake.
I'm going.
Why don't you come over here and say goodbye nicely? Let's be friends.
Baby doll. It's okay. It's okay.
Sorry if I upset you.
It's okay. It's okay, really.
She sets herself up to be a victim.
That's true. Yeah. Yeah. No, that's really the case. Yeah. Yeah. So think about what we were just talking about in terms of these. So what are some of the things that you saw in with regards to some of these things? Yeah, yeah. What set things off is when he's saying, I'm leaving, I'm going back to my wife, right? What else? What else did you say? Yeah, the frantic efforts to avoid the impulsivity, right? Acting out impulsively. Yeah, difficulty regulating emotions. Yeah, you saw she goes from anger to then being loving again. You almost think they're going to have makeup sex there for a bit, and but she is all over the map in terms of her emotions, difficulty containing them. Right? What else? The suicidal. Yes. Right. Yeah. Yeah. It was. I know it's a little bit hard to see the video. So yeah. So I mean, just in like a 2-minute clip, I mean, you see so many of these different behaviors. So as we talked about before, core characteristics with borderline personality. Again, usually more women than men get diagnosed with this. And as I mentioned before, in terms of you have highly sensitive persons who oftentimes will get in relationships with narcissistic personality disorder. Maybe too, Andrea, as you said, maybe that's a setup because their needs are not going to be met, right, no matter what they do. So lack of emotional regulation. Important deficiency is affect stability, emotional instability is the main thing. Patterns of relating. You're the hero or the goat, right? That people tend to either get put up on pedestals or totally denigrated. So there's no in between. You're one or the other, you know. So that's how they tend to see folks. A lot of times can be very clingy, yet also could be rejecting. So they'll come into counseling a lot of times saying, help me, help me, help me. No, you can't help me. You know, they'll get really angry, you know. So they'll test people, and they're going to test you, too, as counselors. Their view of the world is that it's a dangerous, cruel place, and you'll see why in a second when we talk about etiology. Then their view of others, again, it's usually this love-hate. They either love you or hate you. They deal with the world by testing loyalty in many instances. So that's something also very, very common. In terms of etiology, tend to think that borderline personality disorder is rooted in biology. They really feel that it has that there is a biological vulnerability. Environment does play a role, but I think more as triggers. There's about a 75% concordance rate. So if you have a borderline personality parent, you might have a son or daughter, with borderline personality. A failure of individuation is another etiological explanation. So the person really hasn't separated from parents. They have insecure attachments, as you can see. This guy Turcotte is also one of the theorists who said that these are folks who never learned how to problem solve. In other words, when faced with difficulties, especially interpersonal problems, they've never really learned how to manage those. Chaotic family could also be a factor. And they think that what happens is the son or daughter with borderline personality will tend to play into, they'll play a key role in the family's drama that gets played out. Also, in terms of the family, these are folks that grow up with the message that autonomy, individuation is bad, so you don't separate. Misery, sickness, dependence, debilitation is reinforced a lot of times with love or concern, because otherwise there may not be a lot of that. Trauma is a factor. They think about 80% of those with sexual abuse histories don't have personality disorders. So it's kind of interesting. We always were led to think that there was a lot of history of trauma with these folks, but it's not always. That's kind of a recent finding. So let me see if I could find our other video on etiology.
Therapist is being confronted by a suicidal patient. Psychologists on use and Mary's treating these.
Oh, good. There it is. I'm getting good at this. This is Marcia Linehan.
In Dr. Linehan's dialectical approach, there are two important elements that appear to be involved in the development of borderline personality disorder. One biological and the other environmental.
What I believe is that borderline personality disorder, as its core, is a disorder of the emotion regulation system. But what it is an emotion regulation dysfunction. Now, it's important to recognize what I mean by that.
According to Dr. Linehan's theory, this emotional regulation dysfunction comes about as a result of a combination of emotional vulnerability, that is, overly sensitive responses on the part of the patient, and an inability to modulate the resulting emotions.
In a sense, I think of it as a temperament disorder, which is you've got an individual who comes in with difficulty regulating, especially negative affect and possibly positive. The fact that I'm saying it's biological doesn't mean I think it's genetic. There's not actually, the data is not overwhelming that there is a genetic link, although there's a little bit. But it could be intrauterine factors, which certainly can have an effect on later functioning. And it could be some sort of trauma, especially head trauma, at an early stage in life. Okay, so I think there are a lot of ways to get biological dysfunction. And I believe that there is a biological dysfunction. And so what you've got is this group of people who, if you read the developmental literature, are like the slow-to-warm-up child or the inhibited child or the difficult child that the developmental people talk about. Okay? So it's this child who's cranked and can't regulate affect well, okay? Especially negative, they can't regulate. Now, that would answer the whole question if it wasn't for the fact that if all those people were borderline, we'd be overrun with them. Okay, so it can't be that that's all there is. Okay, there's got to be.
In addition to this biological predisposition, Dr. Linehan believes certain environmental factors are also involved.
What kind of environment? is the environment that doesn't fit with a difficult temperament or a inhibited temperament or a temperament where the individual has trouble regulation. The theory is that the key environmental characteristics, what I call the invalidating environment.
The defining element in an invalidating environment is that it pervasively communicates to the individual that his or her private responses to events are invalid, inappropriate, or incorrect.
In an invalidating environment, all problems are viewed as motivational problems, that if you just try hard enough, want to do it, you can pull yourselves up by the bootstraps. It's kind of the pure cognitive therapy environment. You know, if you just think straight, you'd feel better, you wouldn't distort, you'd be okay, etc. Our whole culture largely has this, in some families more than others. Primary reason you don't learn how to effectively regulate emotions in an invalidating environment is because the failure and the difficulty in regulating is never taken seriously.
The need for validation has particular importance for these patients. A majority report incidents of sexual abuse in childhood, a typical invalidating experience that is often dismissed by others. As a result, the patients do not learn to trust their own responses to events and search the environment for clues as to how to think and feel.
Now, this happens consistently and constantly with people with emotion regulation disorder. What happens all the time is other people say, calm down. Quit distorting. You're exaggerating. Quit being so upset. I mean, when's the last time you said that? Even I, who have this theory, say that kind of stuff. I mean, you know, I think that we all do it because it's so pervasive in our culture, which is fine if you can do it. I mean, I don't have any problem with this sort of culture, except that it's not good for this sort of person.
The point is that the interplay of emotional dysfunction and an invalidating environment results in an emotional instability, which in turn leads to the interpersonal, behavioral, cognitive, and self-dysregulations that characterize borderline personality disorder.
Okay, so think about some of the different things in which people become invalidated. You know, you're crying, I'll give you something to cry about, right? So, and one friend, this is actually, it's kind of a narcissistic mom, but she'd go into the mom and say, I'm bored, and the mom would say, well, go in the other room and hit your head against the wall, and you'll have something to do. You know, so again, these are invalidating kinds of statements, invalidating comments. So again, some of the recent research is saying that it might only be about 20% of folks that actually have a sexual abuse history. Because I mean, what is more invalidating than being sexually abused, right? Especially with incest. So this is a little bit of what Marsha Linehan was just saying in terms of her theory of etiology. There are some researchers who are saying the invalidating environment may be more of an inflammatory factor as opposed to a causal factor. So, and this is the study I mentioned earlier, this guy Richard Paris, 27-year follow-up of people who were diagnosed with borderline personality. There was a really wide range of outcomes. The overall suicide rate was 10%. That's pretty high, isn't it? The mean age of those who had committed suicide was 37. Tended to be more women than men, 65% women, 35% men. But there was also an unusually high death rate from other causes. Only 28% were still in treatment at 27 years later. They found that impulsivity tended to diminish over time, which is good, right? And only 22% met the criteria for dysthymia. Only 5% had a concurrent substance use disorder or major depression. Okay, so it's kind of interesting. So let's talk about treatment. A lot of times people with, major mental health disorders in general tend to misperceive reality. So, and that's, I think, also true with people with personality disorders. They'll either disregard reality or overlook it, right? So the key to treating both NPD and BPD is to help clients make connections. So a lot of the thinking now in the field is that you're not doing like deep uncovering work if you go back to abuse or trauma or things like that. Really trying to help the person in the present. So, but making connections, what I mean by that is making connections between what's happening even within the session and what happens in the outside world. Or making connections between different everyday problems the person is having and how those kind of relate to more pervasive patterns that are going on in the present. So they're not doing a lot of deep uncovering therapy. They're really doing more here and now. As a matter of fact, dialectical behavior therapy is problem solving. It's really about problem solving. So the presenting problems your clients will come in with, it might be a job loss, relationship loss, accusations of inappropriate behaviors, other kinds of rule breaking, or the person may report feeling depressed. So those things are common. So again, with dialectical behavior therapy, take a management approach. As I said, it's really a problem-solving approach. These are some of the different things that Linehan suggests in terms of her approach. First and foremost, agree on what the treatment goals are. What does a client want? What is it that they want to work on? The next part of it is strengthening the therapeutic relationship. So what Linehan does here is to be very clear with her clients. Look, if I do something that doesn't set well with you or vice versa, we're going to talk about it. We're going to talk it out, okay? In other words, you're not going to take this home and act out. We're going to talk it out. Targeting life-threatening behaviors, including NSSI, for example. What's going to be the strategy? And that's where that planning comes in. We're not talking about a no-suicide contract as much as let's contract for safety. Let's come up with a plan. If your emotions are feeling out of control, what are you going to do? It's almost like a relapse prevention plan, right? In terms of, okay, you're going to call me. Here's a hotline number. Here are some people who are supportive that you can be around or call, et cetera. And then also here are some different coping tools. So one of the things I wanted to show you, this just came out. It's called Dialectical Behavior Therapy Skills. So this is like a 52 deck of cards. Oh, you do? Okay. So how the skills are broken down is interpersonal effectiveness skills. And let me give you some examples. Use assertive listening. Assertive listening is just as important as assertive speaking. This means you have to be an active listener. Stop thinking about what you're going to say next. Take an interest in what the other person is saying. Reassure the person you're listening. Ask questions. Practice making simple requests. Find safe opportunities to practice making small, simple requests. For example, ask a stranger for the time or directions. In a store, ask an employee to help you find something. With friends, ask for a small favor, like pass the gravy. The more you practice, the easier it will get. Emotion regulation skills. So there's a bunch of cards for that too. And so use problem solving. Surprise, surprise, right? Use the ABCs of problem solving. A, alternatives. B, best ideas. And C, commitment. First, brainstorm alternative responses to your problematic thoughts or behavior. Second, evaluate your list and choose the best ideas from among your list. And third, identify the time and place to commit to trying your new response. Pick a problem and try problem solving. Do the opposite of your unhealthy urges. So identify an upsetting situation use recently experienced, that you've recently experienced and record how you felt. Then identify what the situation made you want to do, like withdraw, act out, whatever. Next, identify an opposite, healthier reaction, like use assertive communication. Finally, commit to using the new reaction in similar future situations. Use emotion exposure. Relax using mindful breathing. Notice and describe your emotion. Notice it growing or diminishing in intensity. Describe any new emotions or changes in quality. Notice impulses to block or act on your emotion, but don't do either. Keep watching until your emotions change or significantly diminish, and practice that, 5 minutes a day. There's distress tolerance skills, mindfulness skills. Those are all different cards. But again, it's all kind of geared towards problem solving. Quality of life issues. Again, identifying behaviors that aren't working in daily life. Generalized counseling work, the work that you do within the session, into daily life. Like, okay, how can you carry this outside in terms of your relationships with others? Validate problems and teach clients to solve those problems. So in other words, validation becomes important because it's really where we're saying, I hear what you're saying. I hear the pain that you're experiencing. Let's work on it. Okay, so Linehan talks about the importance of contracting. This is very important both with NPD and BPD. We'll be working on goals that you set as the client. What are the ones that they set? There'll be times when you'll be unable to manage emotions. That's when we need to talk, okay, rather than acting on those feelings. And do you agree that we're going to work on these goals together? Okay, so those are all things that are helpful. Let's shift from DBT and talk about another treatment approach that's being used. It's called focal treatment. Okay, and what happens here is that you and your client are agreeing to work on one issue. So most of what goes on in your session will be about that one issue. So it could be relationships, it could be job issues, marriage problems, whatever it is. Again, we're going to try to help your client make connections. Okay, so think about maybe the connection between a fear of abandonment and NSSI behavior. How are those things connected? In other words, what happens is that when you fear abandonment or you're experiencing abandonment, that you act upon that by, say, cutting. Okay, so frustration might be connected to lashing out at others. Could be withdrawing or shutting down. Intimacy fears could be connected to shutting down. Disappointment in others might be connected to concluding that maybe others were acting intentionally to harm you, which could be a misrepresentation, right? So in terms of then trying to focus on that, we might want to get the client to take a look at what other alternatives could there be, or even to check it out with the person. Some of the disadvantages of focal treatment, it can't occur when coercive behaviors are successful in controlling others. So in other words, if the person is getting a payoff from those behaviors, they're going to be reluctant to let go of them. Okay, so whether it's acting out or creating chaos or regressive behaviors, distortion of relationship, etc. So that's where you have to really kind of get the person to try to agree on, almost like an experiment of trying new behaviors. Okay, other ways to kind of facilitate specificity in the sessions as part of focal treatment. Again, a suggestion is made to use a management approach. This is work done by David Dawson. So the therapeutic conversation, again, is limited. We're trying to limit to help the client with a more specific, or even to try to get them to make a more specific or precise statement of the problems they're experiencing. So these are just a few different examples of that. So another approach, this was developed by Kreisman and Strauss. This also becomes a good way to provide feedback to clients. It's SET. So SET is the acronym. What they talk about is making a statement of support to your client, then making a statement of empathy, and then conclude with a statement of the truth. Okay, so support and empathy are really about, I'm hearing you, I can hear that this is painful for you, here's something to consider. That's which falls under the framework of truth. So here are some support examples. I'd really like you to see you succeed at this. I can tell how hard you've tried to change this behavior, whatever it is. You've done a good job tolerating the frustration. I see how you said that. It sounds like that's a good idea, or this is really important to you. If you're familiar with motivational interviewing, I'm sure a lot of you are, they're most similar to affirmations, the OARS acronym that they use. So support is kind of similar to affirmations, because remember, when we're doing affirmations, we're not complimenting the client, we're really kind of affirming something that they've done that's been positive. So we're we're framing in terms of you did this, not, it's not a compliment or it's not patronizing. It shouldn't come across that way. And then empathy. It sounds like this was really difficult. I can hear the confusion you might have felt. It must be really hard that you're feeling that angry. That must have been very confusing. And then here are some examples of truth. But you've done that before and it backfired. I think you'd be better off not getting into this, conflict, but that's just my opinion. It's probably better not to get involved in that situation. This kind of thing usually works out badly for folks. Sometimes we have to do things we don't want to do in order to get something we want. This sounds like it's a case of picking the lesser of two evils. I'm concerned that if you confront your boss, you may end up getting fired. I'm concerned that if you get in your car when you're feeling this angry and have been drinking, you'll end up hurting yourself or someone else. Okay, so, in terms of crises, because we know that borderline personality disorder is about crises, unfortunately. As a matter of fact, we oftentimes talk about a crisis-prone client, and these would be oftentimes your borderline folks. So oftentimes they exhibit a lot of crises. And I always tell this story because I had a colleague of mine, we shared office space, and every session with this one particular client, because you could kind of hear through the walls, and stuff, and she'd be coming in yelling and screaming, sometimes yelling and screaming at him, and the whole session went on this way. I mean, it was just like, So one time I caught him in the hallway, and I said, wow, it sounds like it was a really tough session. And he said, you won't believe this. I haven't even gotten her address, a phone number, anything. Because it was every week was a crisis, So here are some approaches to take. See your client, treat them as a competent adult, okay? You can ask your client how you can best help them in these situations. But wait for the client to maybe give something specific. Counselor provides help, sometimes in the way of resources. Maybe it's a referral to the emergency room, something along those lines. Maintain compassionate neutrality, because remember what I said before, if you don't recognize the drama, you're going to get sucked in. So you have to kind of be neutral. As a matter of fact, there are even a lot of counselors who will say right from the get-go, look, I don't know if I can help you, but I'm going to try the best I can, so. The other thing with NSSI, non-suicidal self-injury, remember it's not actually suicidal behavior in most instances. It's more about affect regulation. Some people even consider it more addictive behavior because it has that quality of an addiction. It's like, I feel distressed, so if I cut, now there's relief to it. Same thing as if I take a drink or something, right? Assess the frequency, the methods that are used, what's been the medical severity of these injuries. Also then ask about antecedents. What were you feeling beforehand? What was going on with you? What kinds of triggers were there? That sort of thing. From there, determine what the appropriate level of care would be. And there's a really good book written by Klonsky and May on non-suicidal injury. And they talk about, can this person be monitored, just kind of seeing them outpatient? Do they need more intensive outpatient treatment? Do they need inpatient treatment? In other words, if this person is expressing more suicidal behavior, there's been more severity, person has needed stitches, things like that, the person may really need to be in an inpatient unit. Once the crisis has passed, though, one of the things that we can do with our clients is we recommend distracting approaches. And we're using those until coping skills set in, like almost until you can do some of these things, or you can get your client to do some of the things that would constitute coping skills. So what are some distracting behaviors? In other words, a person feels like cutting, and we know that these folks tend to be very urgent. There's an urgency to that impulse to want to cut. So what are some distracting behaviors? What are some things? What's that? Yep, ice water on your head. Yep. Or even on, let's say if you're cutting your legs or something, put an ice cube on that. That would be an example. Yeah, thank you. What else? Rubber band, snap a rubber band. Yep. Yeah, you could call somebody. That could be a distraction. And that could actually be kind of a good coping skill too. But some of those things. The other thing is that sometimes we'll have our clients take a magic marker where they would cut and just use the magic marker, because again, they're not gonna bleed, right? So, but then while we're doing that, then we're going to teach some of the other skills. Okay. Oh my God. Okay. So anyway, always maintain a treatment mindset. You know, the client is doing the best they can, and they have to do better. Client oftentimes can't see what they're doing, and yet they have to really modify what they're doing. Sometimes the client can't control these impulses, so we're going to try to get them to develop some coping skills and some ways to change. Clients' relationships are destructive, so they have to really be able to use the relationship with you more constructively. Client has difficulty being motivated, and in order to change, you have to work hard, right? I mean, that's one of the things. There's a substantial risk of failure, but you kind of proceed with the idea that you're going to help your client to succeed. So it's really tough going. It really is. I mean, they oftentimes say when you have a borderline personality client or somebody with narcissistic personality, oftentimes if you refer them to a colleague, we refer them with an apology, right? So, okay. I think we're almost out of time here. I know you have to go to lunch, so anyway, you can download the notes, take a look at them. Thank you so much for being here. It's so many familiar faces. So.
We just want to give you a little something, Dr. Stack.
Oh.
We appreciate everything you do for the university and for our
Oh,
field.
gosh. Oh, thank you so much. Thank you.